we have this health in tech. This is going to be ticker symbol HIT. And they're going to be an insurance tech, InsuraTech. And they had just gotten on the exchange back in December, and they had been doing pretty well. And then you have this big giant drop, but that big giant drop was pretty much market wide. That was after some things that were happening with, well, it was after the DeepSeek, but then the tariff stuff, all that. So you could say that this company, I think they could, and their CEO, Tim Johnson, he's been in charge for a while now. The company's been around since 2014, but Tim Johnson, he has over 30 years experience. They have reported 56% year-over-year revenue growth, and this would be their team here. So this came on March 17th. They have this partnership with Dialcore, which is a bigger company, but that one's not publicly traded. And they made a lot of nice moves to strengthen their leadership team here. So you got this, Dustin, his role, he brings 20 years of experience in insurance and emerging technology and media. So this is like an AI-driven insurance. You could say it connects to the telehealth industry, which I think is going to be pretty big. And also considering that the public health system, public health care, might not be as strong as it once was in America. So you could say people with, and also it seems like they are specifically kind of, they are working with, well, they do have some companies, but mainly people who are looking for self-insurance. So people that might not be working with a company, there's a lot more freelance people out there. So I think this could, and you had this guy, 30 years experience, you have a pretty nice leadership board here. I think that this company could definitely, this person, Janie, is in the cybersecurity, and he just did this podcast that people can now listen to, and that just came out today. InsuraTech, that's what it is, platform backed by third-party AI technology. The Street reports. So we could see what HIT starts to do, and maybe they might reach some of their past levels, which would actually be very nice. And then I was trying to see their revenue stuff. This one's saying reported total revenue for the year 2024, $19.5 million, marking an 1.8 increase from the previous year. The figure comes from TipRank's article. And then the fourth quarter in 2024, they recorded a revenue of 4.9, a slight decrease, but they could be doing things with things. And it's saying the PR release March 17th corroborates these figures. Had the first 20 months unaudited revenue, 5.7 million, reflecting 50% growth. I think this company could do something, to be honest, because I was interested in Oscar, because this one's going to be a Founders Fund one. But as you can see, this one's a little pricey here. And they didn't have that big drop, as we saw with, well, they've been dropping. But the news for the Medicaid cuts is a lot. Ah, man, my fucking taxes are going to go up like a motherfucker trying to make up for these Medicaid cuts. I'm in New York State. But I gotta get more HIT. I don't even know. Medicaid needs, we could really see there is a looming possibility here that Medicaid is going to be drastically cut. And people will have to look for different types of insurance, I assume. I mean, I don't really know what people would do, but you have this one, and then also telehealth in general. I think telehealth in general is going to be big. Ooh, Teladoc, they have their earnings on Wednesday, and we'll see how they do, because on top of the news about the Medicaid cuts, you also have lots of hospital closures, like a lot hospital closures. So we could start to see things. So this one's going to close. Charles Ohio State, private equity puts patients. Oh, that's not good. Not good at all. But, if AI can do it, I mean, I guess I don't even know, but this one in Delaware is big news. So that telehealth companies, TDoc, HIMSS, obviously, HIMSS was looking like they were going to do something, but it looks like we have some negative market sentiment around the board. But always a good time to get into things.